most beautiful aspect of metabolic syndrome is, to a large extent, it is reversible. It just requires a strong motivation. So, coming to how does it affect the cardiovascular system or any other organ? The fundamental abnormality in metabolic syndrome is that because of all these cluster of risk factors, there is increased insulin resistance. That means the amount of insulin that is produced by the pancreas is not optimally utilized, or the effect of this insulin on the organ is reduced or numbed by increased resistance to the effect of the insulin. So there is reduced utilization of the metabolic components, such as the sugar is not handled well, the triglycerides are not handled well. That leads to eventually what we call endothelial dysfunction. That means the innermost layer of the blood vessel seem to become dysfunctional or malfunctioning, which leads to deposition of these cholesterols within the blood pipe. It leads to decreased motility of the blood pipe. That means the blood pipe does not expand adequately to allow the blood flow. Thirdly, it becomes more clottable. So there could be sudden clotting, which may lead to heart attack or paralytic strokes. That is how the major cause is the dysfunction of the inner layer of the blood pipe, which leads to either heart attack, paralytic strokes, kidney failure, or loss of limb. Secondly, this insulin resistance also clusters to affect the functioning of the heart due to abnormal hormonal and neurological stimulation. There is increased stress hormones, which are counter to insulin, and there is increased levels of the heart rate, blood pressure, which eventually causes heart muscle to become thicker and stiffer, and makes it to work harder than usual to supply that extra mass, which makes it eventually vulnerable.